Hey everyone, I'm Sebastian at Performance Play Sports Care. We're going to cover sports hernia self-treatment and self-test today. A lot of you have been dealing with lower abdominal or groin pain. I'm going to show you two things that I really like to do to help settle things down in this video today, so make sure you stay tuned to that to the very end. Before we actually do start though, everyone should probably note that make sure you're actually in the right video, period. Most people with sports hernia types of symptoms are going to have problems into this inguinal region right into here. If an easy reference point is you take the hand and you chop into this area, this is the area most people feel the problem, and a little bit up and a little bit down. The up area here, some of you will be looking for things like lower abdominal strains. They go all the way down into the pubic symphysis or the pubic bone right into the center. Some of you will be looking for adductor strain videos, which is this problem out into here. The trouble with sports hernias is that a lot of these symptoms come in to clash, and it feels like you have three different diagnoses. Some of you will actually feel problems into the genital region. Men will feel testicular tightness, and also women can have a similar thing into the mons pubis, we call it. So I'm going to use this model here in a couple minutes just to give you some reference point of why things may work. But first we're going to start with a self-test, which also doubles down as a self-treatment. And this is something we use with our clients here at Performance Place. It's called skin rolling. I didn't invent this, but it's something we use quite a lot. And so skin rolling is pretty simple. We're going to take the skin, in this case it's my shirt, all right? I'm going to pick the shirt up and try to separate it from my skin underneath. So what we're going to do in a skin reference is we're going to take the skin and try to separate it from the underlying tissue underneath. The areas where we're going to start is actually the crest of the hip, right into here, all the way down into where it drops down into the pubic bone right into here. All right? I like to describe this to people as a freeway. It's a 5-lane freeway, and there are 4 exits. There's an exit here, there's an exit here, and there's 2 exits really deep down into there. All right? Some of this is going to be really sensitive to people. And so I usually have them starting to here, and they grab the skin. Most people will say, well, should I pinch the skin? No, we want to grab the skin. You want to grab it, and you want to shake it a little bit. Okay? I'm going to show you a different version of this at the very end too, but just for making it simple, you grab it, shake it, and remember it's a freeway. You want to start on lane 5, go into lane 4, shake it again, lane 3, shake it again, lane 2, shake it again, lane 1, shake it again. Now we're going to make our way to the first exit on that freeway, which is going to be right around the pointy bone here, but a little bit inward. We're going to grab it right here. Okay? The skin's going to get thinner right here, and as we start to go, as we become more sensitive, that's pretty common. We're going to grab it, shake it, wiggle it, lane 5, lane 4, lane 3, lane 2, lane 1, and down into the next exit, which is lane 5. Remember, we're getting lower and lower. Lane 5, 4, 3, 2, 1, and all the way down into this area, right into where it feels like the hip connects to the body. All right? Another thing you can do is you can follow the path down the freeway into this area, the adductor, a little bit too. And so a lot of people will grab this area right here, which seems kind of odd to do, but just humor me on this, is you grab it and you shake it, and then you make little circles. Okay? And then you move to another area that's a little bit higher, and you grab the skin and you make circles. So you grab circles, you grab and make circles, and you do the freeway on-ramps and exits and so on. And normally what people do after this is they start retesting. They say, twisting, which bothered me before, it's really weird. It doesn't bother me anymore. Sports hernias are pretty characteristic of you rest or you don't twist, it feels better, and you start twisting or doing your physical activity and it comes back. There's no reason this needs to persist with you, especially if something like skin rolling helps. Here's why skin rolling tends to work, and hang on, if this didn't work for you, we're going to go to another thing which works really well in the hip in combination with lower abdominal strains, sports hernias, adductors, and so on. And so here's why this is significant here. All right? Now, the area we're talking about where we just grabbed the skin and lifted, it's the interface between the skin and the musculature underneath. So right between it is like fascia, nerves, and so on. There's nerves that actually come out of this area right around here. This is the upper lumbar spine, and they actually combine to create something called the ilioinguinal nerve, which comes around here and it travels through the layers of the oblique muscles, and it wraps around just into here, and it becomes, it actually comes into the freeway. And there's off-ramps. The off-ramps are the other little nerves that pop off the ilioinguinal nerve. And actually there's the iliohypogastric, which is right into here, which goes to the lower abdominal area. You can check this out on a Netter's model. And so this is normally what people feel when they feel a lot of the lower abdominal strains that don't tend to respond to lower abdominal treatments. And so that's number one. Number two is we're going to go into hip extension, which is a really great way to offload pressure from the pubic symphysis. The pubic symphysis is right here, where a lot of people tend to find their tenderness with sports hernias. And so what we found is doing something like a hip flexor stretch, but not really trying to isolate the hip flexor. Just going through hip extension tends to work. But it mainly works not only when you're straight like so with the foot, you have to have the foot cocked out a little bit, or as far as you can. You creep this guy forward a little bit like your cousin It from the Addams Family, but its cousin is cousin Foot. I used to be Thing, wouldn't it? Thing, the hand. And so we're just going to rock in and out, in and out. The reason why this works, again, is because they've simulated cam deformities or hip impingement, FAI, on people with, on cadavers, and they found that when there's lack of function with the hip in some ranges of motion, specifically internal rotation, then they lose the ability to fully use the hip, and then they end up throwing the workload from normal things like twisting, running, kicking into the pubic symphysis or the pelvis. And so it's an abnormal load because this area is not doing its job. So an easy thing you can do is just get a little bit more range of motion in there so that when you start to do your activity, you have more range available to you. By the way, if you want to learn more about sports hernias, groin pain, adductor strains, we do have a webinar that pops up in the corner. It's where we combine everything into a little longer format, a little more educational about why things work, what you should try next, and so on. So normally, again, this works, the hip extension one works mainly because we're looking at this interface right here. This whole core, pelvis, hip, pubic bone, abdominal interface is really important when it comes to sports hernias because they all work together. We're looking to see how they interplay together. If the hip does not have range of motion, then it will create shear force or twisting at this joint right here, which is the pubic symphysis. And we really don't want that because it's going to create tenderness into this region and things that attach to it too. We're in Costa Mesa, California. We do have virtual and in-person services, so please reach out to us. All of the contact is in the description below.